Welcome to Whole Health. We're happy you're here on this journey of exploration with us as we learn what it means to live a life dedicated to spiritual, mental, and physical health. Before we begin our program, we want to share a brief legal disclaimer. The information provided on this program, including any health-related advice or discussions, is for general informational purposes only and should not be considered a substitute for professional medical advice, diagnosis, or treatment. Always consult a qualified healthcare professional before making any decisions regarding your health. Now, let's turn it over to Pastor Jeremy, Dr. Kala Kleen, and Brittany Pfeiffer for today's episode of Whole Health.
Welcome to Whole Health, the program where we explore the powerful connection between a healthy body and a nourished spirit. I'm Jeremy Higgins, and I'm the pastor over here at Calvary Community Church in Cedar Rapids, and I'm joined by my good friends and experts in the functional medicine space, functional medicine provider Dr. Kala Kleen, and functional health coach Brittany Pfeiffer. Now, every week we come together and we dive deep into how true wellness isn't just about what we do for our bodies physically, but also how we care for our minds and our souls. Because when we align the physical with the spiritual, real healing and vitality begin to flow. Today, we're stepping into a fascinating area that bridges cutting-edge science and natural wellness. We're talking about peptides. These remarkable little chains of amino acids are making waves in regeneration, health, anti-aging, recovery, even cognitive function. But we're not just talking about the science. We're exploring how supporting our bodies at this deep cellular level can also support great energy, clarity, and spiritual presence in our daily lives. Whether you're dealing with inflammation, looking to optimize your health, or simply curious about the latest breakthroughs in whole body healing, today's conversation is going to be enlightening. So settle in, open your mind and your heart, and let's discover how peptides might play a role in your own health journey. This is Whole Health, so let's jump on in.
Yeah, thanks, Pastor Jeremy. So I'm thrilled to be here today, especially as somebody who works with patients really in root cause healing. Peptides have become such a powerful tool. So I personally have an autoimmune condition, and I've been able to put it into remission 3 times, but I've also been able to flare it up 4 times.
There you go.
So it's just been, peptides have been a great asset to keep me in remission and hopefully not have it flare up again, but as
awesome.
well as avoiding like the autoimmune cascade. So sometimes if we have a patient that develops an autoimmune, if they kind of can surrender to cleaning up diet, lifestyle, environment, they can stop that cascade. But oftentimes, especially unfortunately, just under conventional medicine, they're like, yep, here's an autoimmune. This is just what it is.
The cards you're dealt, deal with it.
Yeah, and you start to see like, well, now there's a second autoimmune and then a third and then a fourth because the environment, their body, internal, external, just doesn't get corrected and healed.
Wow, that's wild.
Yeah, and hi everybody. I see how peptides can help support recovery and energy and overall just health and wellness. But I think it's important, and I'm glad we're going to talk about like the lifestyle changes that you have to make, and with those, they're not magic. But
right, that is a big issue with a lot of folks.
Yeah, they're getting a lot of attention, which is fantastic. So I'm excited to kind of dive into this.
Yeah, awesome. So before we push any further, let's just pray a quick prayer for wisdom and discernment as we discuss the tools that God's given us through science and nature. So, Heavenly Father, we just want to thank you for this day. Thank you that we have the opportunity to have this conversation, and I pray that we'd be able to use it for your glory. In Jesus' name, amen. So let's start with the basics. Dr. Kala, what exactly is a peptide?
Yeah, so peptides are short chains of amino acids. They can typically range anywhere from 2 amino acids all the way up to 50 linked together. They act as signaling molecules in the body, telling cells what to do, much like tiny messengers. Proteins are longer chains, but peptides are shorter, more targeted versions. Many peptides occur naturally in our bodies. In therapy, we often use lab-made versions that mimic or enhance these natural ones. So they're often called synthetic, but they're modified after what our bodies already produce. They're bioidentical or very close to our own biochemistry.
Yeah, we have a lot of patients that ask if these are natural. So the building blocks are amino acids, which we'll go into more detail in a minute. Those are natural, but the precise sequences that for the therapeutic uses that are synthesized, they're made in a controlled environment for purity and consistency.
Yeah, so Brittany, can you explain how we get our essential amino acids that allow us to make our own peptides endogenously?
Yes. So we can get them from food. So there's food that have all essential amino acids. Those are called complete proteins. There's 9 essential amino acids, and the body cannot produce on its own. They have to come from your diet or be supplemented. So the best source are animal-based proteins. They're most reliable, they're bioavailable. So here's the list of like ones that can naturally contain all of the 9 essential amino acids. but also in good proportions. Some things will contain them all, but it's not significant quantities that are high enough to be beneficial. So like meat, so beef, pork, lamb, chicken, turkey, fish, seafood, eggs, some dairy products, milk, cheese, yogurt, things like that. Oh. They're generally considered the highest quality because they're easy digested and absorbed by the body. In our opinion, in our office, if you are a vegan or a vegetarian, you'd probably benefit from an amino acid supplementation. Sure. That being said, there are quite a few plant-based complete proteins. However, you just have to be a lot more mindful about how you combine things to get what you need. So a lot of times that amino acid supplementation will just make sure you're getting to the threshold that you need. So some of the plant things that are complete on their own are like soy products. So tofu, edamame, miso, quinoa, buckwheat, hemp seeds, chia seeds. The chia seeds are good, but sometimes they actually do have like a lower amount of those amino acids. Spirulina, which is a blue-green algae, you can add that into smoothies and barely taste it. I love to add that in.
I do it every morning.
Yeah, I get the green one. Tell my kids it's Hulk smoothies. Yeah. It's great. Nutritional yeast is great. It has, if you've never used it, it kind of has like a cheesy flavor. So whenever I make homemade hamburger helper for my kids, they love it, and I always add that in. If I have a recipe that calls for cheese, I'll like do some cheese, but then the nutritional yeast just to add those.
Smart.
Yeah, because it's one of those things that can't really taste it. My kids love it, and it's just boosting the nutritional value. Yeah. Really an easy way to do it, I would say. So those are all provide the 9 essential amino acids in the amounts that we need. There are more options. So like beans, lentils, rice, nuts, seeds, those are incomplete. So they're either low or they're missing one or more of the essential amino acids. But you can kind of combine them to get what you need. So if you ate rice, it's not going to be enough, but you put rice with beans, or lentils, or beans with corn, or peanut butter on whole grain bread, hummus with the pita bread, nuts and seeds with legumes. You have to just combine it. And if you eat a varied plant-based diet with kind of a range of those things, you're probably going to meet what you need throughout the day. You just have to be mindful that you're combining them, not only eating beans. Right. If that makes sense. So tying this back, like how does this, we're talking peptides, so why are we talking about beans and rice, right? But peptides are short chains of amino acids. So consuming foods that are rich in essential amino acids naturally supports your body's way of producing those peptides and proteins on their own. So high quality protein sources help with your tissue repair, immune function, overall recovery. So we've discussed these things in the past, the BPC 157, TB 500, etc. So we'll go into those in more detail in a little bit. But practical tips of what should I aim for? 20 to 30 grams of protein per meal from these sources. Animal sources tend to be more concentrated, like 1 egg is 6 grams of protein, right? Or 3 to 4 ounces of chicken is like 20, 25-ish grams, where plant sources are going to need larger quantities. Sure. For example, 1 cup of quinoa is only 8 grams of protein. So you have to be mindful about volume eating, essentially. Wow.
Yeah, so delivery method matters too. Most therapeutic peptides are given via subcutaneous injection because they break down easily in the stomach. If taken orally. So to bypass that stomach acid, that's why sometimes or oftentimes it's more preferred for the injection. Sure. Because they provide better bioavailability or basically better absorptibility. You have to take a much higher oral dose compared to the dose that you could give yourself subcutaneously just from that absorption purpose. So oral peptides, though, are advancing some useful specific formulations to survive the digestion. Sometimes it just has to do with the capsule that they want it to start breaking down in the small intestine versus the large intestine or in the large intestine versus the small intestine. And that comes with like the capsule technology. Right. Just like from a time of like how long will it take before that capsule breaks down.
That's wild.
So like our probiotic that we have, like that capsule is specifically formulated to be able to survive a range of very high stomach acid versus very low stomach acid, so that we get it to the targeted sequence per. Yeah, it's kind of cool just how it's something simple like a vegetable capsule. Right. That there's design even in that. But I do think with time we'll see better advances. But what I have seen and observed clinically, haven't been able to get that targeted therapeutic with any of the with any of the oral compared to what we observe right now in the injectable.
And I think like I read even like BPC 157, there's an oral version of that would work for certain things and others. I'm sure you'll dig into all that. It's certainly fascinating, like everything in life, it's not a one size fits all situation. So let's talk about real world use. What are common peptides and what are they used for?
Yeah, so we're going to highlight some of the more popular ones. So like we talked about the BPC 157, that's derived from a protective protein in gastric juices and shows really good promising for like tissue healing, reducing inflammation, gut health. So really it kind of stands out a lot for gut health, but then it also is really helpful for tendon and ligament repair. Reports are a faster recovery from injuries and things like that.
Yeah, I was first introduced to BPC 157 over a decade ago.
You're an early
Yeah,
adopter.
it's like that.
Yeah. And it was actually from a surgeon, someone in the medical community who basically had to approach it like, hey, I can't tell you to do this. It probably isn't a good idea. And was absolutely insulating himself from it. But, I had a surgery and my healing wasn't going the way that everyone had hoped. And it was suggested, hey, BPC 157 could potentially be a real game changer for you. It was a tendon surgery, a blown out shoulder. And I didn't know much about it. I started reading BPC, body protection compound. Well, that sounds fascinating. And let's give it a try. And it was amazing. I mean, it absolutely brought me to a place where I had mobility again, because I had, even after surgery, very limited mobility. And I think absolutely changed the function of my life. I was able to move again, work out again, and those were things that, because I wasn't doing them physically, there's a mental and spiritual connection to all of those things that they were weighing heavy. And so absolutely, I've we'll go ahead and say experimented with it a number of times since then. Even recently, actually, my wife is using BPC 157. And stacked with a few other things right now, and is seeing incredible results.
Awesome.
So, yeah, I'd love to unpack that more as we go, but really fascinated by how these things work.
Yeah, I've observed it clinically. So there's some biomarkers when we talk about like GI and inflammatory GI conditions. So one of the biomarkers is called zonulin, and another one is called calprotectin. One is basically a level of how much inflammation is in the gut. It's used to diagnose irritable bowel clinically in the gastrology world. But we've been able to see those be cut in half within a matter of weeks, which is just really profound to be able to see. Like the only thing that was different was the addition of this peptide. We tried to do stuff with changing the diet, changing the lifestyle to see what we can do, creating normal floral balances. But then, when we can't get those certain biomarkers to move, even though everything else is improving, and then to see that the only then change addition was the peptide, just to get those before and after.
Was that the oral form or the injectable?
Well, so one of these is my kiddo.
Gotcha. There you go.
And for him, because again, he was a kid at the time, we couldn't get, all I could get him was the oral, and that's the only thing I could get him to consume. And then as he got older, then we had the heart-to-heart, Mr. 10, 11-year-old, like, hey, this is not that big of a deal. Right. Yes, it's a needle. And so
it's such a tiny, I think people hear needle and they think about, being at the doctor as a kid and seeing that, it looks like a spear coming out at you. This is not that.
Yeah,
and that's important to note.
Yeah, and so we had the autonomy discussion, and then, he's been fine, and he can give them to himself now. So it's been cool just to see what it's done for him, and even in some of his labs and biomarkers as well. Cool. Then we've got... So TB 500 is that tissue repair promoting cell migration and wound healing, which is great for athletes and chronic injuries. A lot of times patients will ask me, what should student athletes do? And there is some controversy among athletes, and they say that these are banned substances. Right now, it's really hard to test for.
Yeah.
With that. But again, in the NFL, this is what all of the NFL players and all the major league golfers are doing. So it's cool just to see the application with it. But specifically, now kind of getting back to the nitty gritty.
I do know that in the UFC, they do test for BPC and TB 500, and you're not allowed to take them.
Are they doing that urinary metabolites? How are they testing that?
I don't know how they're testing for it, but it is something that actually someone who just retired from the UFC is a champion out of Louisiana. Why can't I think of his name? He's talking a lot now about using these now and wishing that he would have been allowed to during his time in the UFC. Dustin Poirier.
Okay.
So interesting.
Yeah, I need to look that because I want to know how they're testing for it, and I want to know what.
He's been talking a lot about it. So
okay,
I'm sure
I need to dig into that.
channel, there's a lot of stuff.
Sure. So then we have thymosin alpha-1, which is excellent for immune modulation. So this is a big favorite for anybody that does have autoimmune. It enhances T cell activity and balancing responses. It's been studied for viral infections and immune restoration. Another big one for just the chronic infections, the chronically ill, and they can't figure out why. Thymosin alpha is just an excellent go-to.
Another one that is probably you've heard of is MOTS-C.
I'm a big fan.
Yep. That's really exciting for like metabolism.
Yeah.
So it's a mitochondrial derived peptide that helps regulate energy, improve insulin sensitivity, support fat burning. So all around like great things, right? It works like an exercise mimic, which means it's designed to stimulate the benefits of physical activity without actually having to do it. So increased endurance, improved metabolism, mitochondrial remodeling. Now this is not like a get out of jail free card. You don't take MOTS-C and not move your body.
It goes back to that magic pill conversation that we started earlier. I think too many people hear that exercise mimetic and go, oh, I'm just going to do this then. And that's not the answer to movement. But yeah, it's an incredible compound. I started using MOTS-C. It is currently May. In October of last year, I used it for 2 months on, a month off, and then 2 months on again, with a few other compounds I'll be happy to talk about as we go. But and over that period of time, I lost close to 30 pounds. I mean, that was not me sitting on the couch.
Right.
That was my diet dialed in. That was my physical activity, 6 days a week working out, weights, cardiovascular.
And you were working out even before that,
Absolutely.
6 days a week.
I was doing all of that before.
Yeah.
And actually, I started eating more when I went through this protocol. I was really heavily into, and it was a benefit to me. I think it helped cognitively, but intermittent fasting was a huge part of my life, and I still love the concept of it, but I'm not doing it right now. I went back to a more basic form, although I would say calorie-wise, I'm not exceeding what I would have been back then, but it's not just that one major meal. But I would say the MOTS-C portion of that stack, you could really tell the difference in what that does mentally, physically. I was really blown away.
Yeah.
But you got to be careful, where you're sourcing these things from. I assume that's part of our conversation. And it's probably, even though you heard it at the beginning of this show, we are not telling you to do these things. Let's be very clear about that.
You need a provider.
CJ is a doctor you're listening to on the radio. She's not your doctor. And so, you're going to want to talk to a medical provider and really get some good information. And there are all kinds of different ways to source these. But really an exciting compound, MOTS-C.
Yeah, and you can go to like pubmed.gov. It's where they keep like all of the database for peer reviewed. And just because it's peer reviewed doesn't mean that it's good data. Sometimes the headline, I think I saw there was an article about cancer supplementation causing cancer. And then when you really read the nitty gritty of the study, it was such a poorly produced study in the first place.
Right.
So again, but if you do want to go to that pubmed.gov and you can type in peptides GI, peptides wound healing, peptides mitochondria, and you can see a lot of the data that is published just for people's own research. But we keep seeing more and more in the animal models and some in the human studies that are showing reduced inflammation. So how they're doing it is those biomarkers like a CRP or interleukin-6. And so when they see those like before and after, so sometimes they can't explain the mechanism of how it's working. They just know that it's promising in some of the studies. But it is showing, again, faster healing and better metabolic health. We're seeing blood sugar markers drastically increase. And so, like, again, back to MOTS-C. So when you stimulate the mitochondria, that's the energy cell that every single cell has. So you just stimulate and support mitochondria health. There's a trickle-down effect that every single cell system then is going to get better as a result. So success stories are often and involve that faster and observed injury, fewer infections, improved energy, and better quality of life when combined, especially combined with that diet, exercise, and root cause work. I don't think, and again, I'm just one lone provider in Iowa, I don't think I've observed anybody do a peptide and it not benefit them. But my observation is only from people who are really already doing really, excellent dialed in with the diet, the exercise, and the root cause. If somebody wasn't willing to do that work, I don't think they're going to have as great of a benefit compared to other people who are really trying to improve their body's environment.
Sure, 100%. And the MOTS conversation too, if you're interested in these things, you might want to look into, there's a peptide called SS31 that's kind of a precursor to MOTS, and then even NAD plus as something you would even use alongside of it or afterwards, and then glutathione, a whole nother conversation. But all of these things, this synergistically working together, it's incredible what it can do for your body. Now, we've covered what peptides are, and some of the popular ones, but a big question listeners probably have is, why are these considered drugs in the first place? So, Dr. Calla, can you walk us through that? Because to be honest, I've struggled with that too.
Yeah, sure. So I never thought as a chiropractor I would be in support of any medication
Right.
or drug or anything that would require pharmacy or compounding. But as a chiropractor, so much of our time is trying to help people's bodies heal and recover without the use of drugs or surgery.
Right.
So we observe Band-Aids on symptoms rather than real correction and the causes of symptoms all the time in conventional medicine. So I was always like, when I graduated in 2009, I'm like, I'm never going to need to make a recommendation for a drug. And then I think God's got a funny sense of humor. And I developed this autoimmune and needed to rely on some medications very short term. But I think medications, when properly prescribed and properly monitored, absolutely serve their purpose. But some medications that I've learned as over time is there's a couple ones. One, these peptides. Two is another medication called low-dose naltrexone, which might be a topic for another podcast in the future, just on low-dose naltrexone. But then application of properly supervised weight loss, which another peptide is like the GLP, which every headline of all of the weight loss on the GLPs, I've seen that completely mismanaged, and people have been harmed by that. Getting it offline and then not monitoring, well, are you losing body fat or are you losing skeletal muscle? When we lose skeletal muscle, those patients are in way worse shape, but their doctor is high-fiving them because now their BMI looks good. But another medications that we see is like a T3, T4 compounded support for suboptimal thyroid function, Xifaxan for patients with SIBO. So there are some meds that I do think are absolutely helpful and vital, but again, it's the relationship with the provider and the prescriptive authority and the patient when talking about anybody about their health. But in an ideal world with a perfect diet, well-managed stress, excellent hydration and sleep quality, many medications or peptides wouldn't be needed in the first place. But in our reality, as we find ourselves and have genetics at play, what our nutrition and life was before the age of 5, the environment. We all live in Iowa, which the Iowa cancer rates are just skyrocketing with the glyphosate, but our bodies can use the extra credit to recover quickly when it comes to these peptides, and they're so much more natural and aligned for immune modulation and truly create some of that therapeutic healing and repair. Peptides themselves are just short chains of these amino acids. Many exist naturally in our bodies, but when we manufacture in their lab and we can hyper-concentrate them at way higher doses than we can get from diet, but then we use them therapeutically, and especially when by injection, they would fall under the FDA's definition of a drug. If something is intended to treat, heal, or affect the structure or function of the body in a specific way, it is regulated as a drug.
So that makes sense. It's more about the intended use and how they're prepared rather than maybe the molecule itself.
Yeah, so let's clarify. There's FDA-approved peptides versus compounded peptides. Approved peptides have gone through a full clinical trials and the FDA review for a specific medical condition. Examples include insulin for diabetes or semaglutide for blood sugar and weight management. These are mass-produced by pharmaceutical companies with standardized dosing. Then we have compounded peptides, which are custom-made by licensed compounding pharmacies based on the individual doctor's prescription. They are not FDA-approved as finished drugs for the many of the wellness or off-label uses that we discussed. They're prepared in smaller batches for personalized medicine, and this allows access to peptides like the BPC 157, the TB 500, or even the thymosin alpha 1.
Yeah, it's interesting. Like the whole approved peptide concept probably will keep things like BPC 157 from getting approved because they're not going to do mass studies. Pharmaceutical companies really wouldn't be able to put a patent on something like BPC 157 because it exists in your body already, and they can't patent something that you already have. And so they're not going to spend the billions of dollars that it would take to do the studies to show, oh, these are good or these are bad. There's plenty of anecdotal studies, but we probably won't see any of that happening in our lives times, but who knows? compound doesn't mean unsafe, though. Is that right?
Yeah, just because it's compounded or even if it's not FDA approved, a lot of times people they want that FDA approval. Sometimes I just think FDA, think red tape.
Yeah.
And going to drive the cost up a lot more. But when it's done through a safe, they call it like a USP compliant pharmacy with third-party testing, they can be high quality. Same thing, like you can look at the spec sheets and understand like what is that molecular structure, what are the amino acids being used in it. But they haven't undergone that same large-scale trial, so there's more reliance on the clinical experience of the pharmacist and the compounding, like the lab techs, and patient monitoring. And so that's, I think, the big thing is just, what is the patient monitoring for therapeutic benefit? What's the rationale? But under the current MAHA push, the FDA is reviewing many peptides for safer compounding access.
Just like to throw in there that we've always said this a couple times, but you need to work with a knowledgeable provider.
Yes.
I know there's so much information out there and you can listen to podcasts or read books and it'll tell you a lot of information, but you really need to know your full history.
Right.
I have family members who listened to a podcast on fasting and then they just ran off with it. And it's they truly did not serve them best. So
Jump into the deep end way too quick. Yeah.
Yeah. So this is fantastic, but make sure you work with someone who knows your health and make sure it fits for you.
Well, and I know some of the biggest concerns are, could this fuel a cancer? You know, are you going to have those cancer cells? And it's you really have to say at the end of the day, we don't know.
Right.
Those studies have not been done. And, in patients with cancer, do we want to give them something and not know, is this going to make your cancer replicate at a way faster and higher rate? That those studies just haven't been done. But I do think it's a valid, concern. And that's why, again, just getting some baselines to understand, well, what's your rationale for doing it? Are there any baselines before that we can get, even just from doing something like blood pressure and food logging, stuff like that?
So I know we've talked about you've hinted at stacks so far, Jeremy. So
yeah,
we're going to kind of talk about what stacking means. So basically it's combining two or more peptides that work together. So each has a string.
Get good. Sorry.
Yeah. So together they can kind of amplify your results. So a popular stack is called the Wolverine stack. So it's the BBC 157 combined with the TB 500. It's named after Wolverine because it often report remarkably fast healing and recovery. So like we said, that BPC 157, it's excellent for local tissue repair and gut healing. The TB 500 works more on the cell migration and new blood vessel formation. So together they get the injury with a broader healing environment. So a lot of athletes and chronic injury really love this stack because of that.
I talked about my wife Brooke currently taking BPC 157. It is being stacked with TB 500, also with KPV, which is really good for inflammation. And so those three together, you also find KPV in the closed stack, which would also include BPC 157, TB 500, and GHKCU. But there's a lot out there. But those three, that Wolverine stack's good. You throw the KPV in for inflammation, through the roof.
Jeremy, if you don't mind, can you just tell us your history with peptides and maybe what you're currently up to?
I've experimented with a lot of peptides over the last few years. I've done a lot of personal research. I don't take these things lightly. I have read a lot of the data on the possible implications with cancers and things. That's pretty much hypothetical. It's unsupported. There's not data for it or against it is the problem. As an argument, there's plenty of data through a lot of FDA-approved drugs that do cause cancers that people use on a regular basis.
Birth control.
Yes.
It's a grade 1 known carcinogen.
Right. So, it's a little laughable that they're pushing that on something like BPC 157, which is one of those that they're really trying to, force that on right now. But several years ago, if you know me, you probably know that I spent a number of years in competitive combat sports. And, I'm 54 now. I've done plenty of damage to my body. And I'm trying to, maintain good health. Over the years, I've talked to a lot of doctors, a lot of functional medicine doctors. I've been blessed to have incredible conversations with Dr. Kalla and a number of just other people in the know. I have a lot of years of medical history in Arizona, and the peptide market in Arizona is very different than it is here in Iowa, where there are just clinics you can go in and have conversations and walk out with your peptides. It's very different than the way that it's set up here. But so I started kind of in a simple process, glutathione. I was just a single phase, just trying to help rebuild. As you age, your body, it naturally just starts to lose the luster that it had, and glutathione exists in every cell of your body. It's part of your makeup, and that was a good place for me to start. I went from glutathione to SS31 to MOTS to but BPC 157 just really shortly a decade ago for that shoulder injury. Then back in 2000, I was in Israel with some good friends. And Keone Koch, locally here, Hard Drive MMA, as well as my friend Iwa Elder, who just went to be with the Lord, who is a professional boxer and held lots of titles. Anyway, blew out my shoulder, and I still actually have a tear technically on my left side, a rotator cuff tear on the front and a labrum tear on the back. And I was to the point, it's COVID hits. We got back, and COVID was in full force, and doctors, it was hard to see people, and I decided to go a different approach anyway. I wasn't thrilled with my results on the previous surgery on the other side, and decided to just go this route, peptides. I also did some blood platelet therapy, which was I think really well received. But
did you do EBO, or what did you do?
I haven't done that. I did where the plasma therapy. Where they take your blood.
PRP.
PRP,
Sure, okay.
And that was great.
Sure.
Not fun in the moment, but it worked. It did what they said it would do, but it wasn't a long-term fix. And so then I turned to BPC 157, TB 500, and KPV. And those three stacked together on and off over a period of about 6 months has given me 95% rotation, where I was probably at 40.
How fast did you start feeling results? Results being better range of motion and less pain.
Range of motion, less pain, able to get back into, workouts and things, just a few short months.
Cool.
I would say even a few weeks, you're feeling like, oh, this is working.
Yeah.
2 months in, it's phenomenal, the difference that you can feel in your body. So there's no doubt in my mind that they work. The question is, do they work for you? Keep in mind, we're all different. I have friends that have different testimonies. Nobody that's had a bad experience, and I know a lot of people that have done peptides and are doing peptides. I mean, a lot.
Sure.
And I don't know a single person that has like this traumatic, I had to go to the ER. There's some injection site irritation for a few folks with certain peptides. Actually, MOTS-C is known to have some injection site irritation. But, for the most part, they're either going to work really well for you, or, I'd say maybe 10% of the people I know that have ventured into this field get more of the placebo effect, where maybe they're just not feeling the effect of it. And part of that might be they're not dialed in other areas, because I'm not their doctor. I'm not sitting down with them going, well, what are you eating? And what's your daily, are you walking? Are you working out? Are you, so it gets a lot deeper than that. That's kind of the surface level, but I've been on a journey, and I personally believe that peptides are the future of medicine. They're not big pharma. These things, a majority of them, they already exist in your body in the form that you're using them in. And so, man, when we're talking about honoring God, this is His creation. That's how I want to, treat my body. And it's been an incredible journey, and I'm looking forward to, more of it as we go.
Yeah, they call it like a regenerative medicine, or regenerative, because it's truly from like a cellular standpoint. It's not masking symptoms or reducing symptoms, because then you're actually not creating any sort of like restorative or healing. Same thing again, like back to the autoimmune conditions. The patient alternative and conventional is relying on steroids long term, which wreak havoc and lead to...
Right. And I think a lot of people, when you start the peptide conversation, they think that this is the same category. Oh, you're talking about anabolic steroids. No, we're not.
Yeah.
That's not this conversation.
Or biologics and stuff like that, which, I have a lot of concerns of. But again, right now in conventional medicine and based on insurance, that's all insurance is covering. And so patients just don't have another alternative unless they turn, or peptides are just a better. So when we look at like pros and cons, there's so less side effects on something that's an amino acid base compared to these
well,
medications.
Just look at growth hormone. When you're talking about growth hormone itself, like a prescribed growth hormone, that wreaks havoc on the body. And it gets prescribed all the time, actually. Whereas there are growth hormone secretagogues like tesamorelin, CJC1295, ipamorelin, and what they do to the body is just encourage your body, to make its own growth hormone. And boy, I'll tell you, I've utilized those at different times as well in different stacks and have 100% noticed an incredible benefit. I think there's 100 conversations in these realms that we could get into, but it is phenomenal how incredibly well they work.
Yeah. So then you've been doing it consistently. Do you do daily doses or do you do?
For the most part, there are some peptides they say you can stay on forever.
Sure.
Glutathione is one that you could just stay on. There's an argument for NAD+ as well.
Yeah.
MOTS-C is not something you'd want to stay on forever, month on, month off, 2 months on, 2 months off, something like that. But I would say over the last several years of my life, I've cycled through peptides to the point where when I'm cycling on something, I'm off something else. And so there's typically a consistency there.
Sure.
Pretty much every day, whether it's a Wolverine stack or NAD+. Actually, I just read a phenomenal article about using MOTS-C and NAD+ together and the potential benefits of that versus using them separately. And so I'm going to do more research on that, and maybe, I'm in a down period on those two anyway, so maybe in a month or two, start back up and try them both and see how it goes. And the benefit is, again, these are natural peptides. You do have to be careful how and where you source them from, but at the end of the day, it's either going to work for you or it's not. If you're being careful with your dosing and everything else, you really don't have a lot to worry about as far as negative side effects go.
Yeah, sure. So when it comes to the dosing guidelines, again, sometimes it feels like it's a little bit of the wild, wild west, but there are website resources where you can put in like your height and weight. That'll kind of help calculate out what you could do on certain stacks.
Yep.
I see oftentimes like the BPC 157 in combo with the TB, both of them will be at 5 milligrams.
Yep.
And then how you reconstitute it with the reconstituted fluid. Some people do 250 to 500 micrograms per day, and it can go right into the site of the injury, like let's say it's a shoulder injury, or it can go into the abdomen. I've also seen some people do like 5 to 10 mil every 3 days on a rotation, or 5 days on, 2 days off. So sometimes it's based on height, weight, and then like what's the treatment goal, regimen.
Yeah.
But some people prefer the daily just because it's then a steady level every single day. Others do weekly for the convenience, or like the long, along with like the longer acting peptides.
There's actually a doctor in Tennessee who's doing the Wolverine stack, BPC 157 and TB 500 in his office with his patients, but with a needle where he's using ultrasound to get into the joint or into directly into the areas that,
What's he observing? Is he seeing
incredible benefits? Yeah. And he's keeping data studies of all these
good.
things. I'll send you some of his information. It's really fascinating. But Reagan Archibald is his name. But do not try that at home.
Right.
And that's one of the things that like he started to share those things and wasn't being really specific on that point, and then came back and was like, you guys, this is not, you can't do this on your own.
you could explode a
doing
tendon.
Site-specific injections helps if you're just still staying in that subcutaneous level and it's closer to the injury. But ultimately, if you just take a little piece of skin in your abdomen, move it around, you don't want to develop scar tissue because then it stops being effective. Your legs, your arms, your side quarters, it's easy to do, but you do have to be careful that you're not overusing one single area and then making it impossible to receive the benefits.
Mm-hmm. Absolutely. Then Khaled talked about the dosing. There's also microdosing. So that is much smaller amounts, sometimes 50 to 100 micrograms. And those are taken more consistently or frequently over longer periods.
I'll be honest, like the dosing, the typical dose you read about online, I can't do that with MOTS-C.
Oh, sure.
I can't.
Yeah.
I have to microdose it. My body will almost reject it that way. And you'll get a sense of, and I wasn't one who had ADHD, but I had friends who were, and they would take what is
the stimulants, the Adderall,
like
and then
the Adderall, yeah,
for sure.
And you like I have
felt very similar.
that from doing a typical dose shot, and I went, well, I don't think that's the route. And so I started doing some more research, and so you get into the microdosing conversation. And that's almost how I approach most of it at this point.
There's evidence that it's protective too. I mean, the studies haven't come out in great numbers. I hope someday it does. But patients with the Alzheimer's gene, and it's known as like type 3 sugar
type
on the
3
brain.
diabetes.
Yeah, and even evidence, even if they don't have a weight issue, but if they have a fasting insulin over 7, that it can be very therapeutic from a cognitive support standpoint, be doing super microdosing on the GLPs. But again, you want patients to be monitoring their weight loss to make sure if they lose weight and it wasn't intended, is it the wrong type of weight? Because then that could be a titration issue as well. But I like the idea of cycling. Some patients, like we were saying, 4 to 8 to 12 weeks on, and then take a break or rotate to a different peptide. And again, I'm just a proponent. I love that regular lab work and monitoring to make sure that, again, we're being safe and smart and clinically rational about why we're doing the peptides. Right,
yeah. I mean, at the end of the day, these are tools. They're not shortcuts. You got to go all in, keep every part of your life balanced. And, that includes and probably starts with your spiritual life. Stay in the Word in the morning. You want your life to be better. BPC 157 is not going to fix your life, but God can. Let me throw that in there.
Yeah.
So let's talk about the regulatory side. Dr. Kella, help us understand like on-label versus off-label use.
Yeah, so on-label means the FDA has approved a drug for a specific indication. Off-label is when a doctor prescribes an FDA-approved drug for a different use based on clinical judgment. So this is very common and legal. So a very classic example is Viagra was originally FDA-approved for cardiovascular issues, but became famous for its side benefit for men suffering from erectile dysfunction.
That's wild.
Yeah. Side note, if you have erectile dysfunction, I would love for you to go get a cardiovascular workup first.
Right.
But oftentimes patients can go to their doctor, explain their symptom, and then get Viagra as a prescription. My concern for that is we need to make sure that there's not peripheral artery disease or a reason for that symptom in the first place, or suboptimal testosterone. That's another reason. But during the pandemic, thymosin alpha-1 was explored for immune support. I was a huge benefactor. Thank you, Dr. Stephanie Gray, for putting me on thymosin alpha-1. I loved it post-COVID. My COVID symptomatology was like barely anything at all. But I told her that. She's like, let's put you on this. But I probably should have been on it because of the underlying thyroid autoimmune. But I couldn't believe how much better I felt. But some of the clinics used it for off-label specific for long COVID. But our friend Dr. Fauci and the agencies pushed back on unproven marketing claims for long COVID. Retrospective studies have suggested potential benefits, but it was never broadly approved for that use in the United States. So I was really disappointed. I think it got pulled after like month 6. And I could feel a difference. So now they've come up with a different formulation, for it, but it is not, to my knowledge, it's not the same as the original alpha-thymosin one. But unfortunately, this highlights the tension between innovation and regulation.
Yeah, and this kind of ties into the broader like MAHA movement we've been talking about, which has helped push conversations like talk about prevention, longevity, metabolic health, and patient autonomy. Which is becoming, people are wanting to speak up for themselves and get their own, be in charge of their own care.
I just don't think a lot of people feel like the government cared enough, and that trickled down to their medical providers. And so you got to stand up for yourself if you don't feel like someone else is. Yeah,
absolutely. And so luckily, like RFK Jr. has been really vocal about his interest in peptides. So we're hoping he kind of like spearheads this to be making them more accessible. He said he was a big fan after his own positive experiences. But part of this MAHA movement is the idea Americans are looking for proactive tools to help, not just like health span. I know we talked health span versus lifespan. We want to be able to live well while we're living, right? So people want to know, like, how do we preserve muscle, especially as everyone's on these GLP-1s? Like, this is such an important conversation. Immune support, metabolic health, all of those things, optimizing brain function. So peptides have kind of become a really big topic as a part of this, to targeted specific signaling pathways rather than just big, pharmaceutical things that once you're on one, now you're on another one. Or I have patients who come in who are, have a Hashimoto's thyroid. They're like, yeah, my doctor just told me there's nothing they can do. Like, they didn't even give them options. Wow. And so it's like, here's your autoimmune disease, good luck. And then now we've done nothing about it. And then like the autoimmune cascade starts. So specific particularly for women, unfortunately.
Yeah.
So this is why we kind of love this movement. So it's emphasizing the importance of bringing all these therapies into, regulated and medically supervised environments. So that way we're getting good products, right? We don't want to just buy some random website.
Yeah.
It's really important to
A lot
get.
of people are doing that. Watch
Yeah.
out.
And it's also important to talk about how, just like with hormones and supplements, peptides work best when the foundations are in place. So your sleep, nutrition, your muscle mass, your stress, all that. And it's not a more is better situation. We want targeted, individualized care. Peptides can affect different signaling pathways, and, stacking or any of them should be done very, appropriately and with a lot of thought and research and intention behind it. So, but I think all this interest right now is because people are frustrated with the reactive healthcare model that we currently have. They want something that focuses on earlier prevention and recovery, vitality. So peptides are kind of becoming part of that larger shift towards personalized and proactive care.
Yeah, I've kind of thought about peptides as, the dental field where there's preventative medicine dentistry. It's like for years it was the only preventative medicine, and chiropractic really fell into that category. And now peptides, that's a big part of the conversation. But with any therapy, wisdom is key. What should listeners consider?
Yeah, so informed decision making, one of the three things that I would always like patients to, ask themselves, what are the pros, what are the cons, and what is my alternative, to this. Conventional medicine is going to be very restrictive on what is the established standard of care, what does the organization, so if you work for a big hospital outfit, I know providers that cannot prescribe even a GOP, and they're oncologists.
Okay.
So sometimes that is based on their malpractice insurance not allowing them to cover it. A friend of mine had a private practice for medical. She's literally a board certified obesity medicine specialist, and her malpractice would not approve her to prescribe T3 compounded. They just would not. Yeah, they would just not cover it. So again, just maybe even be asking yourself, what are the potential limitations of your provider in general? But when it comes to peptides, they are not magic, and people have to remember that every intervention, even chiropractic, has an associated risk.
Sure.
Nodes to peptides include long-term effects for some compounds, including, getting the optimal dosing. Like you said, you were too high, knowing how to titrate that. That too high of a dose had a negative or, not a great side effect for you. And then individual responses. Quality and dosage does vary from product to product, but always use those reputable sources. With a physician oversight is the most helpful. Potential side effects are usually mild, but can include injection site reactions. I have had a patient, they actually did get an infection. They thought they had been doing cleaning, practices, but we do have bacteria on our skin. And if you take a needle and drive it in, that can then be a fuel to a deeper reaction.
Yeah, I think also there's, as part of that conversation, side effects, keeping in mind, I had a friend in Arizona who was on a variety of peptides and he could not sleep at night.
Oh, sure.
And he called me up, this is what I'm doing. Why can't I sleep? And I said, well, it doesn't make sense. I've done all of those. I've never had any trouble sleeping. When are you doing it? And he was doing MOTS-C at night. And I was doing, these other ones at night before. And so I thought that would be maybe the best time.
Yeah.
And well, no wonder you can't sleep.
You're taking an upper.
So you do have to watch your dosing, but also, keep in mind that not all peptides work well together. And there's some that are supposed to be taken first thing in the morning while you're fasted. There's some that are better after you've had a meal. There are some that should be taken at night right before you go to bed, and you shouldn't have eaten within 2 hours of going to bed. And so you have to keep all of that in mind as well. It's not just, let's just jump in and stick 100 needles in my body. That you really have to educate yourself, and as a part of that, sit down and talk to a healthcare provider that can help educate you on these topics.
Absolutely. So kind of piggybacking on that, make sure we do our research,
right.
Work with quality providers, because you might hear this, you're like, wow, BPC 157, MOTS-C, I'm all in. I want to do this. But making sure, one, the dosing and the timing and everything is appropriate for your specific situation. Like, you may be different than your husband. You guys can't just do this together. And, it's very individualized, as is all healthcare, or it should be anyway.
Yeah, I did have a friend who was on a weight loss drug and then started sharing it with his wife. And she was having a terrible time with it. And I had to really read him the riot act. Like, what are you doing? This is not how you approach your health, her health, your family's health. Really taking into consideration all of the layers is so important.
Yeah, weight loss is just so interesting because there's still over 100 different reasons why weight loss might be difficult for one person compared to the next person. And men and women are just so physiologically different, despite what some things in society wants to try to say.
Right.
But yeah, when it comes to the peptides, just, is this addressing anything that's root cause? What does the evidence say for my situation? Are also just very helpful questions as people are navigating the peptide conversation in their head and with their providers.
Yeah, so peptides, ultimately they represent exciting tools in God's creation for supporting the body's healing, but they do require discernment. I would encourage prayer, and then absolutely get some professional guidance. I want to thank Dr. Kalla and Brittany, of course. You guys, as always, are amazing listeners. Again, let me encourage you, consult your healthcare provider. If you don't have a healthcare provider, maybe consider reaching out to these ladies, getting into the office and having a conversation with them. Dr. Kalla, how can they get a hold of you if they so intend?
Yeah, so we have our website, which is www.mybackinline.com. From there, you can peek around. We do have an online scheduler. They have a discovery call. They can connect with Brittany, or they can schedule themselves right there online, or they can call us at 319-892-3363.
Amen. So highly encourage you, get in there, get to know these ladies. Also, you know what? Get into church. Connect with the Lord. Spend some time reading your word. Take some time to pray. You guys, it's beautiful outside. Take your shoes off, go outside, and stand on the earth. You'll benefit from that. Thank you so much for tuning in today. We love you. We'll talk to you soon.
Thanks for joining us today on Whole Health. If you'd like to learn more about our program, have a question for our hosts, or want to find past episodes, just head to wholehealthlive.com.